As temperatures decline, COVID case numbers are slowly rising. Victoria has seen a 60% increase over the past fortnight. More than 5,700 cases were recorded yesterday. Hospital admissions are up by 20 from last week to 204. The state's Chief Health Officer says Victorians should remain vigilant for symptoms and have their 2023 booster. Well, joining me live is Professor Robert Booy, infectious diseases paediatrician. Always great to see you. Thank you so much for your time, Professor. So yes, COVID case rises in Victoria. What about the rest of the country?
Well, there's a little nudge all up and down the east coast. I talked to Tasmania yesterday. It's probably just the grandchild of Omicron. We haven't had a new variant since Omicron came along 18 months ago. And what we're seeing now is the progeny, the grandchildren, which are slightly different, and they're a little more evasive of human immunity. But indeed, it's not more severe. And the people who really should be gearing up for a booster are those who are vulnerable and having their fifth or dose or even more if they haven't had one in the last 6 months. It's important for people to be reminded that their immunity from vaccination or from disease can wane. And if you haven't had either disease or a vaccine in the last 6 months, you would benefit. You're a vulnerable person, elderly, major medical problems, from a booster against COVID.
And Professor, speaking of vaccines, flu vaccines, a lot of organisations are offering free ones. Cases, though, are reporting we're seeing a huge increase compared to last year, but perhaps that's due to lockdown.
Yes, when we released the lockdown last year in March, we got a huge surge from overseas, as well as a lot of local mixing in parties and sporting events and workplaces and schools. So flu was moderately bad last year, and we expect it to be probably about the same this year. Kicked off early last year, and it could easily be kicking off early this year too. So it's valuable to get your flu and your COVID jab at the same time, one in each arm. That's tolerated well. It works, it's immunogenic, it's protective, it gets the job done 2 in 1.
All right, yeah, a bit of a pincushion we are, aren't we, these days? But tell us about some of the flu symptoms, because we hear a lot of people that are saying perhaps they have worse symptoms than COVID. Obviously, everyone's different, but what is the medical side of it in terms of, what we get?
Well, everyone is different, but it's true to say that COVID is still a threat. And in last year, we had 15,000 Australians die of COVID, at least, possibly a few thousand more. In a bad year like 2019 or 2017, 5,000 to 6,000 people die of flu in Australia. So COVID is still a bit worse than flu. Both are severe. In the majority of younger people, it's a milder illness. It has to be admitted, and you get over it usually in days to a couple of weeks. But the people who are pregnant women, people who are Indigenous, people who have a disability, all of them benefit from higher levels of protection because they get disease more severely. They're more likely to be hospitalised, more likely to die, but both are worth preventing against, because both in vulnerable people can be quite serious.
And Professor, this week the New South Wales Health Department, they've warned parents to be on extra alert for measles symptoms. It's following an infectious child who spent a number of days in Western Sydney. What is the latest there?
Well, we achieve 95% uptake of measles vaccination by 2 years of age in children. We're great at getting young children protected. But there are smaller communities where immunisation rates aren't as high as elsewhere, and they're more vulnerable to having a chain of transmission, person to person to person. And although most cases of measles in children result in being unwell for a week or so, there are the minority of kids, maybe at 1 or 2%, who can get it more severely, ear infection, and occasionally it can affect the brain and cause an encephalitis, about 1 in 1,000 cases. So that's a real concern. We can't measure who's going to be the one who's going to get it severely, so it's worth protecting everyone. That's the point of universal vaccination. You can protect directly, and with measles vaccination, you can also prevent transmission. So you protect yourself and your community and your family at the same time.
And for people that perhaps a little bit concerned, they might have been around the Western Sydney area, what are some of the symptoms that they need to look out for?
Yeah, so measles can start a bit like a cold with a runny nose, a fever, a sore throat and a cough. And then a rash starts more on the top of the body of the face and it spreads down the arms and the trunk. It's a lumpy rash. It's pretty obvious. It's not a hives or a rash you're used to seeing. It's an unusual, very spotty rash that stands out. If you know your contact history, you've got a better chance of thinking this is more likely to be flu. And if you are concerned, before you go to the GP, ring them up so that you can be put into a separate room so you don't infect anyone at surgery. It's good to talk to a GP about it and to get your concerns addressed, but sometimes you have to make sure they know whether you're infected before you come into the surgery.
Yeah, how infectious is it? Like how do we transmit it?
It's much more infectious than the flu or COVID. It transmits like those viruses through the air, through respiratory droplets, and also potentially through contact, through touch. So much as with COVID and flu, except it's much more transmissible. On average, in a susceptible population, one person infects at least 10 for measles, whether it's fewer than that for fewer than that for flu and less than that for COVID as well.
Well, stay well, and thank you very much for joining us on this Easter long weekend. Always great to see you, Professor Robert Booy.
Thank you very much. Good to be with you.